Ugandan by nationality. I've grown up in Uganda, and I've lived the experiences everyone else in Uganda lives, where we face challenges in medical facilities when we take our patients. Sometimes we don't get what we think is best for them. Yeah, sometimes we find ourselves on the toasted part of the coin. Yeah, so that inspires me a lot, and it brought me to this field where I just had to make change.
Perfect. Thank you so much. And of course, let's begin off the real topic. What
Yes,
is health
please.
according to the Raw, and what
Yeah.
is Raw itself, so that our viewers can fully now understand the real health and Raw before we go into the real issues.
Thank you so much once again, Mr. Kamara. Health, when we talk about health majorly, people think that health is related to disease, but in the actual concept and the definition of the World Health Organization on health is not the absence of disease or merely infirmity, but it is a segment of life that deals with the whole welfare, well-being of a person, and it also includes their mental health. So in that direction, we need to give health an holistic view besides the disease that we see, but also prioritize the welfare or the well-being of individuals. Yes.
So how do we do that?
Majorly, we should start looking at health from a number of dimensions, inclusive of one I would suggest, or that has been suggested most oftenly, from the human rights-based approach. The human rights-based approach views health as a human right. And in our context, in the Ugandan context, through the national objectives and through Article 45, we get to a point where by inference the right to health is realized in Uganda. We have what we call the national objectives in our constitution. Mr. Kamu, we have what we call the national objectives in our constitution.
National objectives.
The national objectives. The national objectives come before we go to the part where we have the articles of the constitution. The national objectives are guideline, you can say the guiding principles on which our governance is based.
Okay.
And in those national objectives, we have the right to health recognized. It is not, the right to health is not expressly recognized in the Constitution of Uganda. It's not provided specifically under our Bill of Rights. That is in Chapter 4 of the Constitution, where we have the Bill of Rights. But it is through inference that we talk of the right to health. The framers of the Constitution were very specific. They knew that at a certain point, the Constitution that had been drafted at the moment might not accommodate all the laws that we need in our governance, and it might not be exhaustive enough. So they put in a provision that recognizes rights that can accrue even though they are not provided straight in the Constitution. Maybe to talk more about the national objectives, we have Article 8A of the Constitution. Article 8A, it breathes life into our national objectives for them to have a justiciable effect. And our courts of law in Uganda have given life to the same through a number of precedents. We will be talking about precedents in this conversation. I hope our viewers will be comfortable with this. we'll be talking about precedents, we'll be talking about decided law and cases, but all in regard to health.
You have to be so simple because, I mean, this is a conversation and I'm also learning very
Yes.
many things in this conversation.
Yeah, sure.
Provided that Raw hasn't been so much given attention when it comes to health.
Yeah.
We want to learn every small word that makes a lot of sense to our viewers.
Yeah.
So let's speak about right to health, right? Let's talk about more on that, and then we'll go to the patient rights, the health workers' rights, and how you come into play.
Oh, thank you. I will again catch it up from where I was. I was talking about Article 8A.
Please do.
Now, in this country, we've had a notion that the national objectives are not justiciable. But that is no longer standing. We have had court on different occasions pronounce itself that the national objectives are justiciable and enforceable. Specifically, in the case of Godfrey Nyakana versus Nema, the court held that the national objectives are no longer mere principles, but they can be enforced as though they help in interpreting the Constitution of Uganda.
Okay.
Yeah, so
So
why
what
am I
does
talking?
that mean?
Yeah, why am I talking about that, and why am I sealing and emphasizing that part? That is going to help us understand how the law comes into health. It's going to help us draw that bridge from the national objectives to Article 45 that recognizes rights that are not straight into the Constitution. We are now going to see the right to health in Uganda and how it comes to play in Uganda. So
Okay.
there's benchmarking on that. We can now build a conversation on the right to health. And
Perfect. Thank you so much. And I just ask that we shall not get lost amidst this conversation because it is really novel of its kind. But of course, we want to
Yeah.
inspire viewers that you steer on Health and Beauty program, Google Data Vision. We are trying to blend how better the raw and health can be in one accord so that all sides are catered for and we know each side so that we are protected and of course we aren't caught off guard in our practices as health workers. Personally, as a health worker, I'm licensed and regulated by a certain council. So in case anything goes wrong, so Mr. David, let's
Yes,
run
please.
to right to health and what it means to the public. We shall first explore it very well so that our viewers can fully understand
Yeah.
what does it mean to them.
Yes.
And what does the government actually, what can it do in regard to right to health? What does it mean for them from the government perspective?
All right. The right to health is not only a national right here in Uganda. It is an international right recognized by the global village, like the international community.
Okay.
So when we are talking about the right to health, we start with a number of international instruments. We have the international, the common document that, or the common instrument that is going to guide us is going to be the, you look worried, Mr. Kamara.
I'm
in this
listening.
kind
No,
of
no, 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 no. I'm
conversation.
listening. I'm actually learning.
Oh, yeah. We have the International Covenant on Social and Political Rights. So the International Covenant on Social, Economic and Political Rights gives us the yardstick for inferring the right to health. Uganda is party to that instrument. And by virtue that Uganda is party, it is obligated by the provisions and the obligations provided with therein to ensure that all citizens of Uganda attain the highest attainable standard of health.
Highest
The
standard.
highest attainable standard of health.
That must be English only.
Yeah?
Please
The
continue.
highest attainable standard of health. Now, we look at a number of factors when we are implementing this, when we are actualizing this. The right to health being a socio-economic right. It is different from a political and civil right. So, when we are seeking its applicability here in Uganda, there are a number of factors that come into play. You've heard often a word called progressive realization. Progressive realization.
You realize as we continue, or it is just, please?
Yeah. Progressive realization is majorly, I could simplify it by saying it is majorly where we have one right, or where we have the resources available, and these resources available have to be apportioned in a manner that does not hinder the realization of other rights. So in all the planning, in all activities that the government is obligated to do, it is obligated to ensure that the right to health is realized. But again, in realizing it, other rights must also be realized. And it takes us to a point of financing. As much as we like health, we cannot have it without proper financing. And this has gone on before we even came to this conversation. Thinkers sat and they made at least a provision that requires the government to finance the health sector with at least 15% of the budget, the national budget. And that commitment was made.
The national cake.
Yeah, the national, you could call it the national cake. I can't call it the national budget. That commitment was made in the Maputo Protocol.
Yes, at least I have heard about Maputo.
You've heard about the Maputo Protocol. Yeah, so in the Maputo Protocol, in the Abuja Declaration, to be specific, it's the Abuja Declaration, governments are obligated to make at least 15% allocation to the health sector. But continuously we have seen a trend where this is not...
Just opposite.
This
To
is
ground
not
they are different.
Definitely.
Now, what are those discrepancies as a lawyer?
You see, we have what we call that principle of progressive resource realization. We could say that we are bad by resource. But if we continue financing health in a manner that is way below the belt, it becomes a retrospective or retrogressive step taken. A retrogressive step in a manner that we have not given it a chance for over 6 budgets continuous in a row to finance at least above the required standard of financing. We have stayed below, and that becomes retrogressive. At least if in this year we have not financed health to that expected or required standard due to the resource restriction, let us finance it better the next financial year to enable us heal a number of discrepancies. For example, you're going to see the interns are suffering, you're going to see a number, the health workers on this and that, you know. Yeah.
Perfect. So I wanted us now to discuss how best those discrepancies can be actually covered away from what exactly is happening on ground when it comes to health and law that could be bringing the discrepancies in health budgeting before you go to the patient rights. You know why I'm running the patient rights? Because we need our viewers to understand what belongs to them.
Yeah, true. Mm, I would request that you rephrase it a bit.
Mm.
Yes.
Want just to discuss the discrepancies, why you think that the health budgeting has not met the declarations that people have signed over time
Yeah.
in the protocols and the declarations by the Abuja such staff.
Abuja Declaration.
Yes. Why does it remain in the notes, but not on ground?
First and foremost, you realize that our budgets, when they're coming, a big portion of it, it's in date. Agree with me?
Mm.
And the finances and the financing hand of the budget usually might not be the state at the peak.
Mm.
Most of the finances coming in at a strings attached kind of organizational arrangement. In a certain, with a certain funding comes a certain string attached. So you might find that we are not sovereign enough to determine our budgeting priorities. Where are we allocating our money? Despite us being or sporting the difficulties that we have found, we don't have enough sovereignty to determine our budget funding or financing spaces. Yes.
So that's the major issue, and of course,
That's a very
and
pertinent
of course, this affects the overall health performance. When now this again affects the health service delivery to people in different areas.
Yeah.
Perfect. Now, do you mind us going into the patient rights and what does the law talk about health and rights for people in Uganda and what's on ground from experience?
Yeah, patient rights. Patient rights are quite, I could look at them with a big lens, a magnifier. Why would I look at them with a magnifier? There are incidences that a person is going to be made a patient by what they consume before they become a patient. I've seen a lot of work going on food fraud. Food fraud is one thing that is going to affect a normal person and lead them to a stage of being a patient. So the rights that are there for a person before they become a patient even is the right to adequate food. When we start talking human rights, one of the things that will amaze you is the interconnectedness between them, the interdependence between them, that one affects the other, and without the full realization of the other, we shall have a bad realization of another. Poor enforcement of consumption, supervision, and manufacturing of products affects people so bad, and it leads them to being patients. If people continue consuming foods that are high in sugar, intentionally made high in sugar, high in salt, and high in fat, they are going to find themselves catching cardiovascular diseases. They're going to find themselves with hypertension, cancers, diabetes. And they are going to spend the rest of their lives in a patient wing. Now, if I'm to delve straight to the patient wing, the rights they have when they are there. Why have I started with food? I bear a broad and a realistic statistics, and some realistic statistics, that 50%, 51% of a Ugandan's expenditure is spent on food.
Yes.
And that being the factor, it means that food is one of the leading causes of a patient situation. Because you are surviving on it on a daily. So that's why I've extended far and then come back to the patient wing here, where we find our friends and colleagues suffering in most cases. One, when a patient is in the wing, they are entitled to a duty of care from the doctors and the health workers and providers. When a person is in a patient wing, how does the law play and how does the law protect them?
Perfect. We'll go for a short quick break. When we return, we shall discuss how, of course, the patients who are on ward, if you are hospitalized in a different place or in any hospital in Uganda, what should you expect and which laws can protect you? From the next discussion, we shall start from there. See you shortly.
Good Day TV, transforming your life.
Wayagala ebyuma ebirungi ebyogera basita pasiteri atunda nange ngoma nekita zonna basita pasiteri amplifier n'emizindalo basita pasiteri ebitala bya siteji ebyebika byonna basita pasiteri ebyuma bya events tubirina byonna basita pasiteri awutudo wa screen tupangisa basita pasiteri kukizimbe kya Newmark William Street basita pasiteri kati ndogendayo musajja mwesigwa kituufu endo gye gisoboka ekibanja mpola akikwata bagula ebyekkanisa jangu ewa pasita pasiteri
tusangibwa ku kizimbe kya Newmark ku William Street ku ground floor room number N31 opposite DFCU Bank. Esimu noti 78200 ne noti 75200 wana wakawe tusangibwa.
Life is a race, not against others, but for a purpose greater than yourself. Every step you take matters. Every decision you make can change the course of someone else's journey. At Makere Full Gospel Church, we are running a race too. A race to purchase land next to the church compound so as to expand our parking space and build more infrastructure for God's work. With your purchase of Run Your Race book, authored by our very own Pastor Fred Wantanti, for just 30,000 Ugandan shillings, you're not just buying a book, you're joining the race. All proceeds from the book sale will go toward purchasing the land. Together, we can build a legacy that will last for generations. Buy your copy today and let's run the race together.
Good Day TV, transforming your life.
Once again, you're most welcome to Google Data Vision Health and Beauty program. Every Wednesday, 8 to 9 p.m. More is here, and of course, bring to you different experts from different fields to bring you good information. But very insightful tonight is that we are learning about health and draw. This very night, not very cold. I'm not warm, but I'm in the neutral phase because I'm learning so much about health and draw. And before we went for a quick break, we were talking about the patient rights when in the hospital. Many of us have experienced different energies in different hospitals, in different clinics. But tonight we want to explore what should you expect from health workers and what should you do in case you feel maybe you're not done in the right way. And I'm still having Mr. David Ruleti. He is a lawyer by profession, and he has loads of experience when it comes to health and rights. He's very passionate when it comes to health performance in Uganda. You are very passionate about health, so I can tell the viewers, because over time I have seen you, over like 2 years actually, you've spoken about health over time. Please take us through the patient rights while you're in the hospital, and those gaps that you might have identified as a practitioner.
Thank you so much, Mr. Kamara. Thank you to the viewers that are on this program tonight. Health rights and patient rights are quite big if you give them the consideration they need. First and foremost, we have what we call medical negligence. Medical negligence occurs where a patient is not treated with the duty and standard of care they deserve when they are at the patient wing. And that is accruing majorly from the health worker at the wing failing to take the critical steps they need to take to ensure that the patient gets the best out of the health worker's skill and expertise. But in Uganda, we have a twofold problem. The ratio of a health worker to patient is not as required by the World Health Organization. So at a certain point, you might hold the health worker accountable, but you also have to have a third eye that shows you that they are being overworked. But before we go there, I would like to talk about the negligence part.
Please do.
In this country, we have the famous Njereketa case. A patient who was amputated on the right side and they needed to be amputated on the other side. That case gave us what we base on today to determine medical negligence. And through all that conversation, there are two things that we usually are going to base on. And those are the things I started talking about. The duty of care that the medical provider owes to the patient. And then the knowledge or the skill and expertise they hold. So the duty of care, Mr. Kamara, that an expert owes to a patient is not ordinarily a duty of care any other person will owe. The standard is quite higher. In normal cases, we infer to the reasonableness or to the test of a reasonable man. A reasonable man now, when we go to our bits in law, we usually call that a man at the Clapham omnibus.
What does that mean?
But without much technicality, I would say a reasonable man is what another person in such a circumstance as you were put in would demonstrate the skill they would demonstrate, the kind of care they would demonstrate if they were in the same
Shoes.
situation, in the same shoes.
Mm.
And that will also come back to you as a health professional in the decision that you are making while carrying out an operation.
Mm.
Would another doctor take the same procedure? You know, hospitals and health facilities have this consent they make people sign before going for operation.
In everything, consents everywhere.
Yeah, majorly.
Even taking pictures, everywhere there is consent.
But that shouldn't be a death trap.
Mm.
It shouldn't be an excuse for you to lose the required skill or the required duty of care that you owe to the patient.
Mm.
And what happens in case you fail to meet that standard of care? What happens? If a patient has documented well everything that has happened and they have made their good evidence available, you can't be prosecuted.
Has documented very well.
Yeah, you know,
Have noted very well.
the problem with the patient and our viewers is that they fail to document. You understand?
Mm.
They fail to document when injustices are happening on them. We are in a situation where we think everybody is vigilant. That's not true. I hope you bear me witness, since you are always at the hospitals and hospital health facilities. You know that some people are not very mindful, even when it comes to them being deprived of what they deserve.
Sometimes you have no control over.
Or what do you mean?
Have you been sick? Very sick? If you've been sick, that means you are the most humble person. And the other person is around you can be, yet please do this. But you as a patient, you only want a person who has expertise. Even if they came and talked to you, it would be better than even your attendants who are shouting. Me, I've seen actually patients who speak to their attendants, please, can you speak to them better? Can you talk to them well? Because for the patient feels they're actually doing better than, and for the attendants actually waiting out and shouting, please, our patient. So bring it out clearly.
Yeah, thank you so much for that guidance. But
no, it is not guidance. I was just giving my experience.
yeah,
I've seen patients who are recovering. Over time, they didn't know, for example, where they were.
yeah,
And they have tried to come out, you know. And so the attendants feel maybe the hospital team is not doing just like, they're still shouting at the team, please, our patient, results have not yet come back, this is 4 days, you know. But again, the patient tells them, please, handle them well. I feel they are doing
what they could.
yes. And the patient actually feels better, he's improving. But for the attendant, still there.
You know, vulnerability when you are sick is obvious. You are vulnerable in some way. Yeah? But it doesn't take away your vigilance. The legal requirement for you to be vigilant remains standing. Your hospital records ought to be kept either by you or by your attendants.
Wow, you've brought a very important point, and actually it comes to patient records. Now you realize that you have digital health.
Yeah.
Most of our hospital records are e-records. Just see a patient, tap, recommend, just pick the patient. We're going to change your management from this drug, and this is going to be for 3 days. So the nurses are going to attend to you. So the nurses will read, they also have the accounts, they tap, read, they start dispensing drugs. Remember when you came, you consented for any treatment, what, but they'll be explaining to you physically on the ward round, but in the system notes, you're not able to access them. And on the discharge, you'll be given a discharge note. You've been admitted for 5 days, you recovered free on this. Please return on this date. Wish you the best. Signed by the discharging officer.
Yeah, it doesn't mean that the law has no remedy for that. We can make an application and request for those records from the hospital. But the easiest step would be that you request for them. If you request for them, are they denied? If I requested for my records,
I think they are given to you. But I still feel e-records have come, of course, to, you know, this paper thing also going to, I don't know.
yeah, I know, I understand, and it is quite environmental friendly when we go e, but for certain purposes, you know, you need a fallback position, and that fallback position is within the documents, the details.
But you see, the patient numbers now, I don't, when did you last fall sick?
I fall sick of recent.
Did you go to a hospital, standard hospital?
Yeah.
You're given a number. Now that number, even if you went in any hospital in Uganda, the person entering will just put your number and see where you got sick from, which treatment do you get from. So we are trying to eliminate the paper system by ensuring that your number, it's like a national ID number. It is given to you according to that number. So when you come to any standard hospital,
Yeah.
they use that patient tracker number to find the condition. Actually, you cannot now lie that you didn't have, for example, this, and yet they are treating it. You understand? So there is
It gets to a point where it's very interesting, but the point I'm trying to make for the viewers is to ensure that you have records. Whatever document that you can receive from the health facility, make sure that you do it. You receive it. It is very hard to hold a person accountable ex nihilo, like out of nothing. You know? If you are seeking accountability, it must be specific. You know? And we need to know the kind of doctor that worked on you when you were in operation. We are not going to, you know, bring a suit that is scattering. Some people don't know the hospital, and you don't know the hospital the operation took place, you know. Some people go to the main hospital and then they are taken to out wings, private hospitals. You know that? It happens. So by the time you would like to take action against the main hospital, it is not to be held accountable because it didn't carry out the procedure. The procedure is carried out from somewhere else by someone who's not that qualified, and the patient was transferred back. And they just got back on treatment, not for the procedure.
those are different dilemmas in
Yeah,
healthcare.
now, and these are the things that are happening on ground. These are the unique problems that are happening on ground. When you talk to a person and they openly tell you that, yeah, I went to the hospital, but the procedure wasn't carried out from the hospital. I was taken somewhere, I don't remember. Then I got back to the hospital for treatment. You understand?
So that one loses the grip.
And you can't now blame the health worker for that. You know? Now that is lack of vigilance on the side of the patient. That's why I call upon the patients to be very, very vigilant. When matters pertain health, please put in your whole heart, strength, and vigor. Because without health, you don't have life.
Perfect. We want to talk about how to seek justice. How can we seek justice related to health in Uganda?
Yeah. Thank you so much for that question. I'm also passionate about children's rights. And
Do you have children?
not yet, but I'm a
Okay.
father figure.
No
in-
problem,
in
you
my-
look.
Yeah. So I was reading statistics from the Uganda Public Health Institute,
Hmm.
and they reveal that at least 63,000 children
Hmm.
are the new, at least are the new
Infected.
infected,
Hmm.
like by
With-
2023.
Hmm.
And I saw 11%
Hmm.
of new HIV infections being among children.
Hmm.
Then I was like, how are these children getting sick, and how are these children getting all these happening to them? Are they having, because a child from 4 to 11 or 4 to 14, it's too early for sex, you understand? And this is a sexually transmitted disease. Okay, we have mother-child transmissions.
Hmm.
But when I read the police report of 2025,
Hmm.
it was showing off defilement as one of the leading
Hmm.
cases prosecuted in Uganda.
Hmm.
Though in 2025 it reduced to about 14%
Hmm.
from the earlier year of 2024. The suspects, 191 of the suspects of defilement were HIV positive,
Hmm.
and these had defied. When we see the conviction rate,
Hmm.
most of them had defied children. So that shows how the transmission to children is coming in.
Hmm.
The first step to seek justice is for us to be an awake regime or generation of parents.
Hmm.
First and foremost, avoid. I know we have small houses. Poverty has crippled the social fabric so bad that a father and a mother and a child are sharing the same room. But where possible, let's avoid having girl children sleeping on the same residings with male children and also male adults.
Hmm.
That's one. Two, let us involve government on its established platforms. We have the Sauti call, that is 116.
Hmm.
Whenever you see a child or a violation of a child right, you call 116 and refer. The probation officer within that area can come and do it. Take on.
I was about to say LC1.
The LC ones have a responsibility, but when you call Sauti, the coordination figures out, you know.
Hmm.
Let's try to use the simplest means available
Hmm.
to avoid bigger crises ahead.
Okay.
Let's get involved. You know, justice is not, people think justice is something you fetch far away. But when, with a simple understanding of justice, it starts with you.
Hmm.
You know, when you seek justice for another person not to get infected by HIV, you don't know that you are saving your child in the future, in the near future. Because these people that are defiling children are repeating defilers. It's his habit, he's on the village, he's a defiler. Do you understand?
Hmm.
The other thing that we need to do as a mode of seeking justice, let's report
Hmm.
issues to authorities.
Hmm.
There are matters that are not concealable within our context. We will not conceal or agree or negotiate matters concerning sexual crimes and sexual violence.
Hmm.
But I was in a meeting recent and I realized that out of 40 reported cases on defilement and sexual crimes, 0 of them were prosecuted. None of them went to court.
Why?
They die at the police station, some of them. Others, they negotiate.
I think negotiation is part of the justice. Now,
No, it's like the family of the victim sits down with a suspect and they offer money to them and they tell them to conceal and not talk about it. You understand? That is not proper, Mr. Kamara. If that is how we shall solve this kind of mode of crimes, we are going to put the future generation at a big stake. Remember, we are targeting elimination, total elimination at a global stage, at a global and international level. We are targeting elimination of HIV by 2030. That is the agenda, that is the goal. But if we don't take these simple steps, we shall not achieve that.
perfect. Thank you so much.
There is more to seeking justice.
Yes, very important. And of course, we want to actually now bring court action. What is your court action to our viewers? The people who are not exercising their rights when it comes to health matters. What's your court action for them?
Yeah, fellow Ugandans, I'd like to begin by saying your participation in governance is not merely a symbolic participation, but that needs to be actual. That actual involvement of people starts again with the people knowing and having knowledge about what to do, which we are trying to do right now. First and foremost, engage more on programs like this one Mr. Kamara hosts. Be on Google TV on Wednesdays and hear about health information. Besides this show, there will be other shows that will come and they will be talking about health and other important segments like Seek Knowledge. See, right now with the innovation of social media, you find that people are more on social media for fun, reading memes, and they are being eroded away from their citizenry responsibilities.
Very true.
You know,
So you are calling upon the viewers to participate in governance?
to participate in governance.
Perfect. What's your call to government as we intend to wind up this program?
The government, I call upon proper financing
Proper finance.
first and foremost. I'm a big believer that we have competent labor here in Uganda. We have brains that can do a lot in the health sector. But if they are not empowered, and that empowerment is not merely talking to them, telling them the goods and the bads, but the empowerment that comes with lifting their well-being and standards of life.
By monetary incentives.
Thank you.
Thank you so much, Mr. David. And of course, we want to thank our viewers. You started with us when we began this important program. We've been talking about health and draw, and we wanted to understand where do you come in when you're sick and what do you expect? What are some of the discrepancies? We've also explored a few areas that we can take part and how we can support the healthcare systems in Uganda. But of course, most importantly, is you participating in health governance, understanding your rights and knowing when to exercise them. Important is that you document everything that you experience in health facilities so that when you want to seek justice, you're supported. I am Kamara Daniel. I want to thank you so much. And of course, I want to inspire you to Health and Beauty program every Wednesday at 9 p.m., but also Good Data Vision programs, our Christian programs 24/7. They inspire you to salvation, but most importantly, they bring you closer to God all the time. I hope to see you next week Wednesday. Take care of yourself. May God bless you.